When a memory care resident transitions into a state of complete dependence, the physical reality of their daily routine changes. The immediate logistical consequence falls on the staff. The physical care load required for basic feeding and night shift monitoring increases, creating a constant state of friction between the caregiver and the patient. Faced with this decline, the default medical reflex in many facilities is to prescribe an additional oral medication. But trying to solve a physical labor problem by altering a frail patient's internal chemistry creates a technical paradox in memory care. This is known as the pill burden. For frail older adults, compounding oral medications often reaches a biological dead end. This chart maps out a human digestive system already managing a complex medication load. Adding just one more variable to manage cognitive decline can trigger a cascade of adverse interactions that a frail metabolism cannot process. This creates an impossible vacuum for the facility. The staff are physically overwhelmed, but the patient's bodies cannot tolerate further internal chemistry. Breaking this cycle requires an intervention that relies on exactly zero internal chemistry. To solve for this, we integrated the Brain Vitality Herbal Pouch. This schematic shows the physical engineering of the device. It is a flat, stitched fabric pouch worn externally at the navel and held by a soft, breathable belt. Here we see the core engineering constraint of the design: absolute zero physical mass transfer. Because of this constraint, nothing is swallowed. The digestive tract remains entirely isolated from the intervention. There is also zero transdermal absorption. The pouch supports the body from the outside without introducing any compounds into the bloodstream. By maintaining this external position, the pouch bypasses the digestive risks that typically complicate care for frail adults. We can see this zero mass transfer approach in practice through a recent observational case study. The patient was an 82-year-old woman with post-stroke dementia. At the start of the study, she was completely dependent, unable to chew her food, and experiencing severe incontinence. Because these specific symptoms required high-intensity physical labor from the staff, her case was a direct test for the efficacy of a non-invasive routine. 5 days into the intervention, the logistics of her daily care began to shift. This graph tracks caregiver friction over time. At day 5, the patient voluntarily opened her mouth to chew, reducing the physical effort for feeding. Simultaneously, urinary frequency stabilized. By day 60, these improvements were sustained, and daily cooperation with staff trended upward. The final reports noted improved bowel regularity and a much higher level of participation in daily care tasks. This 60-day microhistory indicates that biological stability can be supported through external means, without relying on internal medication. This case suggests that practical support for dementia decline does not always require an additional pill. Facility leadership can now implement this approach through the Overnight Stability Pilot Program. The program is designed to integrate these non-invasive care routines into existing workflows without disrupting the facility's operations. By utilizing zero mass transfer, facilities can reduce the physical load on their staff while protecting the health of their most vulnerable residents.